Welcome to Law Talk on WMKV, a public service program hosted through the staff of the law firm Schwartz, Maines, Ruby, and Slavin, determined to see problems and opportunities from the client's perspective. Law Talk is designed to provide listeners with general information and insight into the many areas of the law, and is not meant to be taken as specific legal advice. You should always consult a professional familiar with your own situation. If you'd like to join the conversation on the program, you can call 513-772-9658 or toll free 877-772-9658. Now, Law Talk on WMKV.
Good afternoon. This is Robert Block, and I'll be your host today for our weekly program, Law Talk. Today, we are very fortunate to have with us Chris Mihin from HORAN Associates as our guest. So thank you, Chris, for coming.
Thank you for having me.
Chris and I will try to help you understand some of the legal issues about the topic we are going to talk about today. And then we say all the time the laws continue to change. And what we're going to discuss today is how does the new Affordable Care Act affect you? Remember, this is an open mic program, a live call-in program. So please call in and with your questions or even with suggestions for future shows. You can call in locally at 513-772-9658. If you're outside the local Cincinnati area, you can call toll-free at 1-877-772-9658. You can also go to the website of Schwartz, Maines, Ruby, and Slavin, who are the sponsors of Law Talk. Go to www.smrslaw.com and click on the Law Talk icon, and you can listen to all the past Law Talk programs. Our law firm also has a Facebook, and the shows are linked to the Facebook page. Now, today's show, how does the Affordable Care Act affect you? As an individual, how do I obtain medical insurance coverage under the Affordable Care Act? Does the nature of your job disqualify you from medical insurance under the new Act? What are the financial consequences for failing to comply with the Act? These are some of the topics we're going to talk to Chris about today. Now, Chris, just some background information. I understand you're an account executive with HORAN Associates. Is that correct?
That's correct. I've been there for 6 years. Started the individual health and Medicare programs, helping individuals secure those type of health insurance in the Cincinnati area.
So, as part of your job function is to educate individuals that may need medical insurance coverage.
Absolutely. We do a lot of one-on-one sessions. We do group seminars. Especially since healthcare reform was put into law in 2010. We've done a lot of educational sessions as a company, with one coming up next Tuesday for some employers on what's going to impact them coming up in 2014.
I see you've had some education locally. You went to the College of Worcester, and you got a psychology degree. Where's Worcester College?
Worcester is up northern Ohio, about 30 minutes south of Cleveland. I did that for 4 years and then went up to Massachusetts in the Northeast for a graduate degree in business psychology.
Now, you have certain licensures. I think when I was reading it said life, accident, health insurance. What are these licenses and why do you need them?
Well, a lot of times when you need to be certified and licensed to sell individual health and or Medicare products to the public. And that is showing these folks that you are an expert in these fields. You continue to have continuing education credits, such as in the law profession, to make sure that you're on top of things of what's happening currently in the industry.
Now, I noticed part of your bio that says you're a charter benefit consultant designation. What does that mean?
That means we go through a rigorous program, about a 2 or 3 day session on different various about benefit consulting things, whether it be individual health and mostly affecting group programs.
Now, as far as who needs individual health insurance, I, in my practice of employment law, see a lot of employees who come to me with various issues. And one of the primary issues is that they say, well, we lost our job and they offered us COBRA, but we can't afford COBRA. What individuals, maybe such as these types of people, need your services?
Well, a lot of folks that we work with, not everybody has coverage through their employer or through their spouse's employer. So we help individuals that are self-employed, early retirees that are a little bit younger before turning 65 for Medicare age. And then obviously when someone leaves a company, whether it be voluntary or involuntary, they are eligible for something called COBRA. That is a law that it's instituted that states you're able to keep the current policy through your work, but you have to pay the full amount of money. Your employer stops contributing, and that could get pretty pricey.
I know some other situations might be people with dependent children that are not eligible under their employment plan, or part-time or seasonal employees, self-employed individuals, maybe people that are in between jobs. These are other categories that might need your services.
Yeah, absolutely. Anytime somebody who is not getting coverage through their employer, a lot of times we used to help child-only policies. Maybe someone forgot to put their newborn on their employer plan. Some of those things have been taken away from us through 2010 with the Affordable Care Act going forward, but we're going to be able to help those folks again.
Now, talking about this new Affordable Care Act, and I know sometimes people call it Obamacare, but does this affect individuals and small businesses?
It does, and it starts to get very confusing when it's 2,500 pages and it's continuing to be updated. But yes, it does affect currently individuals that basically they're staying between October 15th and March 14th of this year and going into next year. Individuals are going to have to secure health insurance. Even small businesses that are under 50, those folks are not required, if they do not want to in 2014 at their renewal time, to offer insurance.
Okay. Now today, since this Affordable Care Act affects both individuals and small businesses, as I understand it, your specialty and what you do is you concentrate on individual medical insurance policies. Is that correct?
That's correct.
Okay, so let's stay with that topic for this particular show. Now, this Affordable Care Act, has this ever been tried before, or is this something that's brand new?
Well, in the individual health industry, it is unprecedented. This was put into a law March 23rd, 2010. But if anybody's associated with Medicare at all the last 10 years, it looks very similar when they put together Medicare Part D for seniors in 2006.
Okay. Now, I mean, there's a lot of issues that come up, and I'd like to talk about that. But when you talk about Medicare, how does this new act affect Medicare coverage and people that are eligible for that?
Well, this is a season right now where folks like myself get certified again every year to try to help folks that are going to be going through Medicare open enrollment, which is October 15th through December 7th. But it does affect a lot of these folks, particularly right now with Medicare Part D, which is the prescription drug program available to Medicare eligible folks. It has helped some individuals get better drug coverage during that time.
Just in case the audience doesn't know, who would be eligible for Medicare that this would affect?
There's three groups of folks. It is folks that are turning age 65. It is folks that are under age 65 that are on Social Security disability. For those that don't know that, you need to be on Social Security disability for 24 months before you're eligible for Medicare. We have plenty of clients that are in their 30s, 40s, and 50s that have Medicare, just like someone that is age related, which is age 65.
Why would somebody that young of age be receiving Medicare coverage?
Well, when you are eligible for Social Security disability, that is something that you have to go through Social Security for that. If you've been deemed disabled by Social Security and you're qualified for benefits for 24 months, then you get Medicare just like someone that's age 65.
So if I understand what you're saying is this is not directed, the Affordable Care Act can affect people from the age 30 on up, and if you're of a young age, you may have suffered a disability, you were awarded Social Security benefits, but you may also be qualified for some Medicare benefits.
Absolutely.
Okay. One of the issues is when people get insurance, they have pre-existing problems quite often, and they have problems getting coverage. Does the Affordable Care Act affect someone who's trying to purchase an individual policy who does have a pre-existing medical condition?
It does. I've been doing individual health policies since 2005, and we have to go through a progression to try to help individuals understand if they're going to be able to be approved based off pre-existing conditions. Currently today, people can be denied based off pre-existing conditions. A lot of folks think that they have had employer group coverage and they've had no break of coverage, they should be guaranteed coverage, and that's a myth currently today. What is going to happen with the Affordable Care Act for policies that you purchase starting January 1st is there will be no pre-existing condition. They're called guaranteed issued policies.
So this sounds like a good thing where people, and there's a lot of people out there in the audience that have pre-existing conditions, they're going to be able to purchase coverage.
Yes, I think that's one good piece of this legislation. It's really hard to tell someone that they are denied health insurance. It's a very personal product to each individual. But to come along with everybody being guaranteed health insurance, that's going to be making costs rise.
So what happens if someone already has medical insurance and this Affordable Care Act is going to come into effect? Do they have to change their insurance policy, or can they keep their insurance policy until it expires?
That's a good question, Rob. Basically, everybody's situation's different, okay? So I'm going to kind of keep this pretty general. When they put this law into effect March 23rd, 2010, basically what they said, at least for individual health plans, that's what I'm going to talk about today, anybody that has purchased an individual health policy before March 23rd, 2010, and since then, over 3.5 years, have never changed their policy, whether it be raising a deductible, changing plans within their current insurance company, they will be considered something called grandfathered. If you are on a grandfathered policy, coming into the new Affordable Care Act here that's going to be happening in January, you have the ability to keep your current plan without going through the new, they're called healthcare marketplaces.
Now, I also heard the term, you've used the word grandfathered, and you've explained that, but there was also, I've heard the phrase non-grandfathered policyholders. What is that?
Just as different than grandfathered, non-grandfathered policies mean if you've purchased your policy after March 23rd, 2010, no matter if you've kept that particular policy, if you've purchased it after it, and or if you've made changes to your policy after that date, you are considered non-grandfathered. What that means is at a certain point in 2014, you will have to choose one of these new healthcare marketplace plans.
Okay. What's the magic of this March 23rd, 2010 date? Why is that a date you keep bringing up?
Well, that's when the law was put into effect. That's when President Obama signed the actual legislation, and that's where they kind of used that term for the grandfathered, non-grandfathered.
And as I understand it, this is sort of a phase-in type law because, I mean, obviously 3 years have gone by and we're still phasing it in. Is that how this is working at this point?
Yeah, absolutely. Just like Medicare Part D, the law was enacted in December 2003, but then it launched in January 2006. Same with this law. It was enacted March 2010, and it's actually going into effect January 1st, 2014.
We're getting to a breakoff point, and I again encourage, and I know I haven't said it earlier, but please call in with your questions at 772-9658 or outside the area, 877-772-9658. Chris and I would like to answer your questions, and I know that the audience out there has questions. So we'll take a break and be Good afternoon. This is Rob Block. Again, I'm your host with Chris Mihin, and we are talking about the Affordable Care Act. And please call in with your questions. Again, locally, 772-9658 or 877-772-9658 outside the local Cincinnati area. We left off when we during the break about talking about non-grandfathered clauses. policies. And what are some of the concerns about that, Chris?
Well, some of the concerns I want to make sure folks know is a lot of folks hear this October 1st it's going to be starting and you have to do something by January 1st. It really depends on your situation. Let me give you an example. If you've started your policy and your renewal date on your plan is June 1st, June 1st every year, you're going to be able to keep your plan through June 1st of 2014.
Okay.
Now, what a lot of individuals or a lot of companies are going to do is they're going to send you a letter here in the next couple of weeks, and it's going to say, we're going to give you the option to do an early renewal for December 1st. And if you take that early renewal from your current insurance company, you'll be able to keep your plan through December 1st of 2014. At that time, you will be automatically migrated or transitioned to an Affordable Care compliant plan.
Okay. There are certain questions that people have to ask now, and I know what I like to do. Let's just assume I'm someone that comes to you. I need an individual medical insurance policy. You can assume I'm either single or have a family or whatnot. What questions do I need to answer to make sure that I don't lose or have any lapse in my medical insurance coverage?
Well, currently today, and we'll do both. Currently today, we call it something called field underwriting, where we're going to ask you if you're a smoker, non-smoker, what type of medications you take, what any pre-existing conditions that you may have. We want to make sure that you're able to see if you could qualify before we put you through the application process.
We're going to stop you there real quick because I see Gary has a question. Gary, are you there?
Yes, I am, sir.
Okay, what's your question, Gary?
I'm retired Navy, and my health insurance is TRICARE. Now, will this new law affect me in any way where I have to buy my own insurance now?
That's a good question, Gary. And Chris, can you answer his question?
Well, I would have to say with you having now, Gary, let me ask you a question. Are you under age 65?
Yes, I'm 61.
Okay. How I perceive, when you have TRICARE or any type of retiree plan before age 65, unless they get rid of that program, which I don't think they are, you should be able to stay on that plan and not have to go into one of these healthcare marketplaces.
Okay, thank you very much.
Did that answer your question, Gary?
It does.
Well, thank you. It was a great question.
Thank you for calling.
And anybody else out there, if you have any questions, please call in. Again, we've given you the local numbers of 772-9658 or 877-772-9658. Before Gary's question, which was a good one, you were talking about I'm coming to you as a customer, and you were going to ask me certain questions. I mean, like about smoker. What else would you do?
Currently, it's what medications you're taking, what pre-existing conditions you may have. These all type of things right now make a decision. It helps make the insurance company's decision if they're going to either rate your policy up, meaning having a higher premium per month, or if they're actually going to even offer you coverage. How that's going to change to next year when you have to go into a healthcare marketplace is really it's going to be about couple different things: your zip code, your date of birth, and basically if you smoke or not smoke. Other than that, you're going to be able to go onto a healthcare marketplace, or healthcare.gov is what the government is promoting, and to try to find a plan that best fits your needs.
Well, I'm confused, Chris, because, this all sounds very complicated to me, and I'm coming to you, and you're saying maybe, am I going to still be able to go to a private insurance company and say, I want to buy coverage, or do I have to go to some type of government source and say I want to buy coverage there? What do I do? Where do I go?
There's going to be a couple of different sources. You're definitely going to be able to still get insurance through private insurance companies. Okay, but there's going to be different sources on how to do that. If you go to healthcare.gov, you'll be able to find the plans that are going to be on something called the public exchange. That is going to be through the government. It could either be through the federal government or through the state government.
Well, how do you know? I mean, which plan is through the federal government or through the state government? Or how do I know if I should pick one of those or go go to some private company? How do I make that decision?
Well, the one thing that you're going to see, just like Medicare Part D in 2006, there's going to be financial assistance. One of the big things with the healthcare marketplaces and exchanges coming up is there's going to be premium tax credits and cost-sharing subsidies for folks that qualify. Basically, if you're between 133% and 400% of the federal poverty level, you may have the ability to get a subsidy to help pay your premiums.
So, what's an important factor is the amount of income either an individual or family makes as far as what you would qualify for?
Yeah, correct. So one example is if there's a family of four that makes $90,000 a year, you may be eligible for roughly 10% of a tax cut or of a subsidy for your premium.
Okay. Just for the audience, when you talk about subsidy, does that mean that there's a resource, I guess you're talking about a government that helps pay the premiums or what?
Absolutely. And subsidies are only going to be put on something called the Federal Public Exchange. Okay. Here in Ohio, we are letting the federal government facilitate that. If you're in Kentucky, it's going to be more of a state-run exchange called Connector.
Okay. Again, please call in with your questions. Again, locally, 772-9658. Out of the area, 877-772-9658. We'd like your questions. Use the word exchange. What does that mean in relation to this new law?
Well, the exchange is what was used to be called, and now it's called the healthcare marketplace. So that's the same thing. Those are interchangeable words. So I probably should put to bed the exchange word and keep using the healthcare marketplace.
Okay. I've heard something, and you may have referred to it earlier, about an initial open enrollment period. What is that?
What is that? What that is they're going to launch this program. You're going to be able to go to a trusted advisor like ourselves at HORAN. You're going to be able to go on to healthcare.gov as the federal government, or go through private insurance companies, and you're going to be able to find quotes for plans that you could start purchasing October 15th. And they will go into effect January 1st. Now, because this is unprecedented and this is the first time it's being rolled out in the country, they're going to make this enrollment go from October 15th through March 14th.
What happens if you don't do anything after March 14th? What happens to you?
If you are uninsured currently, okay, and you're not eligible for Medicaid, and you choose not to purchase health insurance at this time, they're going to start giving you a penalty for not signing up for health insurance.
Okay, let's just say, here's Rob Block. I'm working with Schwartz, Mains, Ruby, and Slavin, and the law firm says, we're not going to provide medical insurance coverage anymore. So I come to you. What do I do? What's my first step? How do I get coverage for myself and maybe my family?
Well, I think for someone like us, what we're intended to do is help you understand what your options are with a variety of insurance companies. What we are going to do is going to try to find out if you are eligible for a subsidy based off your income. If you are eligible for a subsidy, we'll help you understand how to navigate the public exchange. If you're not eligible for a subsidy because you do make too much money, then you're going to go into something called the private sector, and you're going to be able to go through the private insurance companies' websites, or there's other companies that kind of filter a website similar to Travelocity, where you could try to go onto a website. You're able to pick from various airlines what plan you want. It's going to be kind of the same thing on the private exchange model.
Now, are you going to do this for me? I'm coming to you because I don't know which websites to read and where to go. Would you be doing this for me, or do I have to do this myself?
Absolutely. We do that today. We work with 6 insurance companies on trying to help folks navigate insurance today. It's going to be sort of the same marketplace.
I guess George here, he probably would have to get a youngster's policy because if you got any questions, George, just chime in here, okay? Again, call in at 772-9658 or 877-772-9658 because I know there's people out there with questions. So what types of plans will be offered in the healthcare market? I imagine you may have referred to it a little bit, but what kind of plans do I have to consider if I'm trying to find medical insurance coverage?
You know, it's pretty interesting because even though no matter what avenue you get it, you're going to get health insurance through a health insurance company, but they are waiting it down to the wire to really let everybody know what's going to be offered. What we know today is there going to be a variety of options available. In Ohio, there's going to be 16 insurance companies that are going to be able to help offer you options. These type of plans are going to range in benefit anywhere from a traditional copay plan where someone maybe would have a $20 copay to go see their primary care doctor or $50 for a specialist, and then also still, as they do today, able to purchase a high deductible health plan that you could link to a health savings account through a bank of your choice.
So this new Affordable Care Act, it doesn't get rid of all the other types of policies that we already have in existence that we've been buying over the years.
Mm-hmm. No, but what it does do is it makes you have some minimum essential benefits that are into the plans, whereas before they might be out. For example, maternity on individual plans. Maternity is not included on individual plans today. There's only one company that we work with that you could actually buy a rider for it. Well, in 2014, we'll start calling the ACA, Affordable Care Act, compliant plans, maternity is included. And those type of things, when they're included, it raises the premiums.
So it sounds like it's going to help me when I come to you. I'll have coverage for my wife if she's of the age to have a baby. If one of my family members has a pre-existing problem, I'm going to be covered. It seems like it's protecting me. This Affordable Care Act. It's providing me better coverage.
It is. It could be more robust coverage. One thing that we're still not totally sold on right now because a lot of the insurance companies have not released what the rates are going to be. That will happen on October 1st, is how much more expensive it's going to be in the current plans today.
Okay, so there's an issue as to the cost of premiums and now and versus after the effective date of the Affordable Care Act.
I think the accessibility is going to be wonderful. We just have to find out and try to navigate what plan might be most affordable to you.
Okay, we're coming to another break. So again, please call in with your questions. We'd love to hear from you. 772-9658. Out of the area, 877-772-9658.
And Rob, I just want to mention, for those people who are used to the half-hour version of Law Talk, we are going an extra half hour today to cover all these details. So we just want to remind people of that. Still open phone lines.
Okay, great, George. That's a good point. I knew I had you here for some reason. We'll be back in a few minutes. Okay, we're back again with Chris, who works for HORAN and Associates. We're talking about the Affordable Care Act and how it affects the individuals. Next week, we're going to talk about how it affects small businesses. Again, call in at 772-9658 or out of the area, 877-772-9658. When we left off, we were talking about shopping for some medical insurance coverage for me. Why is it that there's only 16 insurance companies in Ohio? Why is it limited to just 16? Do you know?
Well, the private insurance companies have the ability to either want to participate in this or not participate in this, and it's very interesting. We service folks in Ohio, Indiana, and Kentucky. And there's one particular company that we only work Ohio and Indiana with. And I said, you know what? I think we should probably start working with them in Kentucky. And she said, well, you better wait before we release our plans to see if we're going to do business in Kentucky. So I think, and I don't work for an insurance company, but I think they're trying to be very making sure that they could be profitable and be serviceable in each state and each type of plan.
How does an insurance company become involved with the Affordable Care Act? I mean, what happened to all the other companies in Ohio? What was so special about these 16 insurance companies?
Well, what's really interesting is there's 16, but there's a particular insurance company there that says they'll be surprised if there's 16 carriers doing this in 2016. What I think is there's not many insurance companies that are in the individual health market. Just because somebody may have insurance through a particular insurance company through their employer doesn't mean they offer individual health plans. We see that a lot in the dental industry. I have a particular company with my group insurance, but they do not offer individual dental policies. I wish they would, because a lot of the dentists take them in Cincinnati.
Well, what if I'm with a particular insurance company that's not one of these 16? Does that mean that I have to go and shop these 16 insurance companies and leave the one that I have at this time?
Well, I cannot comment on what would probably happen. I've seen this in the past where an insurance company might say at some point, you know what, we're going to stop selling individual policies in a particular state. You would probably get a letter, and I've seen these before, get a letter that says, hey, your policy is going to end come January 1st. You're going to have to go shop elsewhere.
You know, one thing I'm really concerned about, I'm coming to you for a policy, is I've been using my doctor for the last 25 years, and there's absolutely no way I'm going to leave this doctor. How's that going to affect me when I'm trying to purchase medical insurance coverage under the Affordable Care Act?
Well, as an individual, and when we say individual, that means families as well. That individual means outside of an employer-based coverage. So we get that question a lot. Well, I have a family. Well, it's individual and family. It's just outside of employer. Today, most companies that you work with, you will have something called a PPO, Preferred Provider Organization. What that means is you have a book of doctors. And if your doctor is in that book, you're able to get a particular copay. If you're out of that book, you still have coverage, but you just pay higher for that service. A lot of the companies now, the major companies, have probably 80 to 90% of the doctors and hospitals nationally in their network. What's going to be a major shift for the public to know is when you go into, and this is only supported by what we know today with some of the companies for these new plans, is it's going to be shifting for something called a PPO that we just discussed to an HMO, Health Maintenance Organization. The major difference of these plans is that HMO means you have to stay in a book of doctors. If you go outside of that book and it's not an emergency and it's not an urgent care situation, you will have no coverage. So I think what we will bring great value to is helping individuals understand if their doctor's in the network on these new plans, what hospital system is in the network. We've had a few companies already tell us, insurance companies say, we're working with one hospital system in Cincinnati. Another company even said Children's Hospital is not in our network next year.
Well, let's just say I'm not giving you an option, Chris. I want a policy where I can use my doctor. Then what will you have to do?
Well, what we would do is similar to what we use for Medicare today. We have developed a one sheet called Medicare Product Analysis Form. We have individuals put down their preferred pharmacy, their doctors, preferred hospital systems, and my team goes out and researches those particular plans that we represent, and we come back with a recommendation based off who's in the network and who's not. It's very similar to the Medicare Advantage market, if the public knows what that is.
Well, so as I understand it, if I come to you, you're going to give me some type of form to fill out, and that form's going to ask, some of my personal information, some of my medical history, and maybe some of my preferences with respect to doctors. Is this what I would do?
It would be today, but and that's what we do for health insurance, for our Medicare insurance. But really, to be quite honest with you, it's going to be more factual things. I'm not going to ask you what your pre-existing conditions are. I'm going to ask you what doctors that you want me to look up in the network. A very misconception is, for example, if you have a particular doctor that you use and you've been working at a hospital for 40 years and you've had the same insurance, and then we go do a Medicare plan or individual plan, you say, well, I'm going to go with that insurance company because my doctor takes it. You have to make sure there's a lot of different networks of hospitals and doctors out there. Just because your doctor takes your group insurance with that carrier doesn't mean it's going to take an individual plan with that carrier.
Again, we're talking about a lot of topics about the Affordable Care Act, and I'm sure it affects the audience. So please call in with your questions, 772-9658. Out of the area, 877-772-9658. 9658.
You know, one thing I wanted to just keep going on the network thing is something that would be is a lot different than what we know today. Cincinnati Children's Hospital is a great facility in this area. It's not going to be in the network in some of the major health plans that maybe people are on today. You may have to drive to Dayton for your children or up to Columbus, and that's going to be a major shift. So I can't stress enough to the public that when you have to go in or decide to go into these plans, that you do your homework, or we could do your homework for you.
Well, boy, I mean, you know, I'm a young guy, so people can't see me over the radio, and I have young kids. You know, I mean, I want to go to Children's Hospital. I mean, it's one of the best hospitals in the country.
And it's right in our backyard, and we're very fortunate to have that. That's why, you know, when you are looking at what plans and what companies to go with, you're going to have to make those decisions and do that homework. And again, we're just going to be a trusted advisor to try to help the public to do that.
Is this making it any more difficult with the Affordable Care Act, or are these some of the same things that we'd have to do anyway, or we've done in the past?
You know, people have done in the past. From my experience, I've been doing this almost 8 years now, helped out probably almost, I'd say 8,000 to 10,000 people sign up for health insurance policies. You know, a lot of times now in individual health, if you don't do it, they probably still take, meaning your doctors, because the networks are 80 to 90% of the country. It's going to be just like Medicare Advantage with HMOs, where we help a lot of Medicare beneficiaries pick what plan is best for them, and it's a lot of times based off if their doctor takes it or not.
You know, this is a new law. I mean, I know you say it started in 2010, but aren't there some questions that haven't been answered yet? I mean, I know that, you know, you know some of the things that are going to happen, but I keep hearing, you know, we really don't know the answer to that question right now.
I've said a lot the last 3 years. You know, there's a lot of things that will be put out, and then 2 months later it's changed. You know, basically, you know, what we're trying to do here, I think, with this new enrollment period coming up, is try to go from 0 to 60 in 1 day. And it's going to be a lot of cobwebs. It's going to be a lot of confusion, just like when Medicare Part D was put together. I worked at an insurance company at that point, and it was chaos. So that's why it's very important when you're talking about being grandfathered, if you're a current policyholder, or non-grandfathered, able to keep your plan until your next renewal, that might be your best choice, because you might want the cobwebs to go out the first 6 months.
Sounds to me like, hey, you know, again, they can't see me, so I'm a young guy and my wife's pregnant. And isn't there a chance that I could have a lapse in medical insurance coverage, and maybe, you know, there may not be coverage for her pregnancy? That's an expensive proposition. Could that happen to me?
It possibly could. It really does depend on your current situation today. If you're currently on a plan now, you're not going to get lapsed unless you stop paying your premium. At some point in 2014, if you're non-grandfathered, meaning having a policy after 2010, you will get automatically transitioned to a plan by your current carrier. The way you will have a lapse is if you stop paying your premium.
Oh, okay. So they'll transition you in as long as you keep paying the premiums. They may have to put you on a different plan or a different policy, but
yes,
you won't lose coverage.
It will have to be the ACA compliant, or one of the new plans that have these minimum essential benefits like maternity included in the plan. I think one thing we need to discuss for the most part is a lot of people think, well, and this has been a misconception the last couple of years.
Okay, let me cut off because I see Alan is on the line. Alan, you have a question for Chris or myself?
Yes, for Chris.
Okay.
Hi, Alan.
Chris, I'm Medicare age now, and my wife is not. I've been receiving, or we have been receiving, our health care coverage through a state pension, Ohio Public Employees Retirement.
Is that SERS, S-E-R-S?
Or
OPERS.
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 Okay, yep, there's a
OPERS.
bunch of them. Okay.
Right.
And due to recent legislation from the State House, I think it was last year, the health care coverage will be changing in the next few years, and probably transitioning out, certainly for Medicare. eligible retirees and spouses.
Yes.
My question is that if at any time in the future the coverage from the state changes negatively enough, can one come to a company like yours and have you compare the coverage, whatever it may be from the state, to whatever is being offered through the Affordable Care Act?
Alan, absolutely. We do that today. HORAN services over 500 companies in the greater Cincinnati area. So there's a lot of times that I'm helping someone, just in your case, say, well, I'm now Medicare eligible. I have my group coverage. I have Medicare. What's best for me? We're always looking at that. OPERS is a great Ohio Public Employee Retirement System. I just did a Medicare seminar with them jointly, one of the local counties here, and got to learn a lot more about what their plan is probably over the next 7 or 8 years of what you're discussing. There are going to be possibly some changes in what they're going to offer spouses as well as retirees. The one thing you have to make sure that you understand, which is really nice in your situation, is whether it's your wife now going to be individual if she's not over 65, or it's going to be yourself that is Medicare eligible. When you are on a retiree plan, and whether that goes away or you decide not to take it anymore, you will have something called a special enrollment period. No matter what, even if it's in the mid-July, that you will be able to go on to a Medicare plan for yourself, or a special enrollment period for your wife if she's not Medicare of age yet, to go and purchase one of these new healthcare marketplace plans.
As I read the literature that the retirement system has sent out, within probably, 3 or 4 years, we are going to have to go to the navigator or an outside company like yours for our health care coverage.
Yes, I don't know which date it is right now. It depends. I think they might be limiting some spouse things in 2015 or 16,
right.
Different things like that. What they are going to do, and a lot of big retiree plans, like either the state or state teachers or even big companies, private companies, what they do is there are companies out there that have call centers that help masses of people. And that's not what we are. We're a local company. We help individuals one-on-one. But yeah, they are going to offer something to you to do that. However, you're more than welcome to call an outfit like ourselves as well to help navigate that.
Alan, that's a good question. And, that's why I tried to set up the hypothetical with Chris here, is like I'm someone who needs to shop around maybe, and you're in the same position. And I think that's a great question.
May I ask one other thing that is a broader question?
Okay.
For people who are Medicare eligible, in the coming years, how will things change compared to right now for people that are on Medicare as their primary and are getting a supplemental insurance plan through, say, AARP or an outfit like that? How will things be different?
Well, there are going to be some changes happening already with Medicare. Right now it's pretty interesting. Medicare open enrollment is the same time as this new plan for individuals that happens. So October, November is going to be a pretty busy time in the healthcare industry. But one thing right now, I was just at a conference in Arizona talking about strictly Medicare supplements. And they have said with the House and the Speaker, they've said there's going to be no changes to one of the most bought plans in this country, Medicare Supplement Plan F and Plan C. Those are first dollar coverages. They're really good for Medicare members. The other option, Medicare Advantage. There's a lot of cuts that are happening with reimbursements from the government to private companies. So what you're going to see in the open market, and Alan, I think for you, as you are going to be transitioning possibly in the next couple of years, just see what the landscape is starting to happen, because there's a lot of plans there that are the Medicare Advantage landscape is going to look a lot different now in 2016 than it does today.
Hey, along with what Alan's saying is, if he has Medicare but he needs a secondary policy through a private insurance company, would Alan, looking for the secondary insurance company, would he go through the same things that we've been talking about throughout this program?
Yeah, I tell you what, I mean, it's just, as I said at the beginning of the show, Medicare has gone through some of these enrollment periods and marketplaces. You're already doing those type of things with Medicare, as you're going to start doing as an individual under age 65.
Okay, that's a really good topic you brought up, Alan. Did Chris answer your question?
Yes. Let me ask Chris something about his particular practice.
Yes.
Is there a charge for using you?
That's a great point.
Certainly you're getting, I would imagine, reimbursed on a commission basis or some basis from the insurance company.
I don't know, Chris. Do you do this just to help people?
I won the lottery about 2 years ago, and I'm just, I love doing this.
You just love to sell insurance.
No, Alan, to answer your question, if someone, and this is a great thing to know for everybody, and I'll speak specifically to Medicare because you're Medicare eligible. If you are certified to do Medicare and help folks navigate through their options, you cannot charge a fee. Okay, to that person. If you decided to work with our firm and we helped you navigate 5 or 6 different companies and we signed up a plan, we would get a commission from that company as long as you were our client and we were your agent. It would be the same premium for you. You would get the same benefits. Hopefully you would get better coverage by going through HORAN.
And Alan, if you have more questions about Chris and how he operates, you can call us after the show. You can at my phone number, which is 579-1414. Ask for Rob Block, and we'll provide any further answers that you may have or get you over to Chris.
Thank you so much.
Oh, thank you, Alan.
Thank you, Alan. And I said something briefly. I didn't mean better coverage through HORAN. I meant better service.
Yeah, I understand you, Chris. Again, Alan, that was a great question. Same with Gary. Please call in with your questions. Again, locally, 772-9658 or 877-772-9658. That's sort of interesting. I mean, is there any there's some complexity to this, and I'm sure it concerns a lot of people. I mean, are there any online sources for individuals to go to check or to start preparing themselves for these enrollment dates that are coming up?
Yeah, and I think I've said it in the past that, the healthcare.gov, www.healthcare.gov is the federal government's website to just try to help everybody with their broad answers. There's an FAQ section. You're going to be able to go on that and see if you qualify for a subsidy or not. It's been a very good website. But again, I also think the Kaiser Foundation, that's another outfit that's been giving a lot of good factual information.
Yeah. Well, I want to thank George for that question. I always keep asking him for questions, and he finally gave me a question.
I want to briefly say something. We discussed the leaner or more narrow networks of hospitals and doctors. I just want to let you know that at some point there's going to be, on a lot of these plans, you're going to have less medications on the drug lists as well. So you mentioned confusing, and there's people that are going to want to do this pretty early to make sure that they're giving them a good opportunity to make sure they're making a quality decision on their health care.
Well, that's a good point, because I imagine some of our audience out there have certain medical conditions that they have to take a monthly medications. And those medications can be pretty expensive, and if they don't have coverage, that could be a real problem for them.
And another thing that's happening with one of the insurance companies, and probably another to follow, is maintenance medications. A lot of people take their pills. Some people don't like to use mail order service. There is a few insurance companies out there that are requiring maintenance medications to go mail order. So again, you're going to have to do your homework, or have an advisor to help you try to sift through this.
Well, one thing that scares me, they talk about penalties. What happens if, I don't purchase insurance company? Like as I told the audience, I'm really young and I have no medical problems, and I just say I'm not going to buy a medical insurance coverage. What happens then?
Well, there's going to be some penalties involved. It's interesting because they're really trying to push this through without it all being laid down in stone yet. When I talk about if you're eligible for a subsidy, you're able the first year to self-report your income. And if you at some point do get a penalty for not signing up, it's going to be coming through your tax when you file your taxes off your income tax.
What was really important is I had a son, he was under 26, and I sure did like having the opportunity to have him covered. Can I still cover my children up to the age of 26 with the new act?
Yes, that's something that has changed. And it had all across federal guidelines that you were able to keep your folks on till your dependents on till age 26, and even in Ohio, in some instances, you could keep them till 28.
Oh, well, there's also the issue of lifetime limits, or you can only have so much coverage paid, and then you've reached your limit. Is that still an issue under the Affordable Care Act?
It is not. If you're on a non-grandfather plan today, there are unlimited limits. Another one that's already enacted is preventive care benefits are covered at 100% on all plans that are non-grandfathered.
Does an insurance company, after the Affordable Care Act comes into effect fully, I guess I should say, can they refuse someone and refuse to sell them an insurance policy?
They're going to be guaranteed issued policies. Now, if someone does miss the open enrollment period,
Okay.
if you are uninsured, okay, and you miss that open enrollment period, you're not going to be able to just, if you break your arm May 15th, to go purchase a plan May 16th. A lot of misconceptions about that. Well, I'll just get health insurance when I get sick. That's not going to happen. Just like Medicare, there are going to be special enrollment periods. And you're not going to be able to get there's going to be an open enrollment period each year between October 15th and December 7th. And if you've missed your time period, you're going to be able to sign up at that point. But if you're coming off a company plan, let's say you retire and you're 61 in May and you end May 31st, that will be a special enrollment period when you're losing group coverage, whether it be voluntary or involuntary, that you're going to be able to purchase a plan at that time.
So there could be a lapse in coverage, and you could have some problems if you get sick or get injured during a lapse period?
Yes. So I think if you are uninsured, this is the time to look. If you've been denied based off pre-existing conditions in the past and you cannot get insurance, I think this is your time to at least look at it starting October 1st, and you'll be able to sign up for those plans October 15th for a January 1st effective date.
Well, Chris, it's been a very interesting show, and I know there's a lot of questions about the Affordable Care Act. There's some very positive parts of it. Maybe some people feel there are some negative parts to it, but it appears at least it's the first step. It's a start to help solve the problem and provide medical insurance coverage to everyone. Like I say in my practice, sometimes I get people coming into my office and said they lost their job, and one person I remember had diabetes 1. I think her medical insurance medications were $1,400 a month, and these are life and death situations. She's got to have her medicine. So I think maybe this Affordable Care Act, maybe it'll solve some of these problems for these individuals.
It is a good step. It's not fun telling people they're denied insurance based off health conditions. So I think there's a long road ahead. I really believe. I don't know how affordable it's going to be at this point. Insurance premiums are going to rise, but they were worried about Medicare Part D in 2006, and 7 years later, although it's not the best thing, it has helped a lot of folks with their prescriptions. And I hope when we're talking, hopefully in 2016, 17, we're saying the same thing.
Well, unfortunately, we've run out of time. This is a very interesting topic, and I'd like another hour. Can I have it, George?
We'll do it next week.
Okay, so as you heard George said, there's going to be another show next week for 1 hour on this topic of the Affordable Care Act as it relates to small businesses. So we'll be back on the air next Thursday, and I want to thank Schwartz, Mains, Ruby, and Slavin for sponsoring the program. If you have any questions or comments, you can reach me, Rob Block, at 579-1414. And if you need to reach Chris, I'll make those arrangements for you. Thanks, Chris, and thanks, HORAN and Associates, for allowing you to come and be a guest today.
Absolutely. There's a lot of things happening here, and by all means, we don't know it all yet, but hopefully we're on track with it, and we're happy to help anybody that needs help.
Well, we hope we can get you to come back again sometime and have a further discussion about medical insurance as it relates to individuals. So at this time, we're going to sign off, and we'll see you next week. Thank you.